next we have Dr. Kathy James. Dr. James is an epidemiologist and engineer who specializes in environmental and climate risk factors and health in vulnerable populations. She has experience in leading and conducting community-based research projects, including NIEHS-funded studies investigating exposure to metals and cardiometabolic and kidney diseases. Dr. James is currently leading 3 community-based studies investigating the impacts of long-term drought on a rural community, including access to water resources, the impacts on agricultural workers and mental health, and water quality and exposure to pregnant women and children. Dr. James is also the PI for the Attitudes and Behavior Study, a repeated population-based survey of tobacco and marijuana use and other public health issues. And my fun fact about Dr. James is that we get to work with her on a project. Visible Network Labs was lucky enough to get to participate in an ongoing project. And I don't know if you're going to even talk about that today, Kathy, but we're just really excited to be a part of the amazing stuff that Dr. James is leading. So I'm going to hand it over now and let you take over.
Great, thank you. I'm assuming you can see my presentation. Okay, great. And actually, it is the study that we're collaborating on that I'm going to highlight. So thank you, everyone. I'm going to be presenting about our work specific to a rural community that I've been working in for the past 15 years, the San Luis Valley, highlighting our one of our multiple studies that are down there specific to working with farm workers during the time of climate stressors, especially drought, and the social network analysis that we are leading. So as an introduction to myself, I'm an associate professor at CU, and we kind of covered this, but one of the key things that I wanted to highlight is that most of, if not all of our work is community-based participatory research and involves not just the partnering with our community members from the start and the initiation of the concepts of the study, but all the way through and then all the way into the report and manuscript draft writing. And so we have several networks within the community, the organizations, health providers, schools, teachers, community advocacy groups, and we feel very privileged to be able to work with them. So the San Luis Valley is located in south central Colorado. It is the largest mountain desert in North America. It's also a community that has one of the most richest cultures and histories in the West. Their economy is mostly agrarian and tourism. And their agrarian economy is mostly potatoes. They're the 5th largest producer of potatoes in the United States. They also produce barley and alfalfa. Hemp is also a new product, and then also cattle ranching. Within the tourism, the San Luis Valley is also the location for the Great Sand Dunes National Park, which is also one of the more popular national parks in the US. So unfortunately, the community, which is bounded by 2 very large mountain ranges on the northeast and the northwest, and then to the south, it flows into New Mexico through the Rio Grande Rift and aquifer and river systems. But the community itself has been experiencing a prolonged drought since 2002. And this is as a result of changes in temperature patterns, including increases in average temperatures from about 61 to 64 degrees. And these changes in temperature have led to a decline in the snowpack, which is the greatest source of water for the community. And then not only that, but the snowpack is also melting faster and melting earlier. And all of this has dramatic impacts on the farming system, not just for access to the quantity of water, but then also the timing of when they get the water. Additionally, not only is their surface water and river systems declining, but so is their aquifer system. So this overall drought process has had a dramatic impact on the farming community. Over the past 10 years, there have been many farmers who have been incentivized to fallow their land, which means it's a non-producing land. This has led to decline in food production, a decline in the economy, a loss of this lifestyle and heritage that's very important and has been in the San Luis Valley for the past 180 years. It also has led to an increase in anxiety and depression, and then also addiction and suicide in our farming community. So through my community networks with my other studies, I work quite a bit with occupational cohorts, including the agricultural community. And it was after meeting with some of the agribusiness leaders, farm owner and operators, and the farmers union that I became quite passionate about the mental and behavioral health for the farmers given this drought. And the reality is this drought isn't going away. This is projected to be a long-term community adaptation and mitigation process. And so we have connected with several national organizations, including AgriSafe, that leads several efforts across the nation specific to total farmer health. And so this is the model that we've incorporated for our study that looks at the burden, the need, and the impact specific to farmers, where the burden is on financial stress, chronic pain and illness, and drought, and including right now, especially right now during this economic period of time of financial stress, where we're seeing fertilizer and fuel being probably the greatest burden financially, outside of the fact that they have less access to water. And the types of questions farmers will wake up is, do I need to slaughter my 8 cattle because I can't feed them? And so to wake up every day and have to have those major types of decisions can induce quite a bit of adverse mental health. So we're partnering with Vision Network Lab, and we're leading a 2-part community-based survey for agricultural workers because probably the most important thing we identified is that the extent of behavioral health and what are the resources and what are the connections, the extent of that has not been very well characterized. And so that's the purpose of this pilot study. And so we are using the Partner Me platform developed by Vision Network Labs to interview 250 agricultural workers just to understand what is the extent of their well-being and what resources do they use or do they have access to within their communities. We are, and I should stress, we're including both farm owner operators and then also field laborers, migrant workers, and then also seasonal laborers. So the Partner Me worker survey specifically for the ag workers it involves an online platform that will assess about what are their typical stressors, and they will identify what are their stressors, what are the resources that they use, are they community-based resources, are they peers, are they worker-based resources, and then the platform will then develop these connections within them and will provide a report for each individual. With this report, then VNL is also going to be completing an extensive analysis, social connections analysis, coupled with our additional survey that does a complete well-being assessment of the farmers. So all the participants will be compensated for their time. They will be provided with some immediate results, and then they will also be provided with a full summary report of representing the entire community. We do also have built-in parameters so that if any participant identifies a level of stressor or any level of depression or anxiety or suicide ideation, we do have pop-up resources that they will be immediately directed to. As the second part of this is we're then going to be interviewing and meeting with the community resources that are there specifically for behavioral health. This can include agricultural and agribusiness centers, medical providers, religious groups, peer groups, the agricultural extension offices, and then also resource centers. The point of contact at each of these organizations will be compensated for their time, but by bringing together the organizational connections and the resource connections along with the individual farmer connections, we will be able to identify and thus be able to develop an engagement plan. How do we best work with the community to engage with farmers as a way of, one, reducing the stigma of mental and behavioral health, and then also ensuring that they're getting access to the resources that they need. Oops, hit the button twice. All right, so absolutely along the same lines that Mika was presenting, is that the key thing is that rural communities are extremely resilient, and they have an extensive amount of local and community groups that are working every day to support one another within their communities. We have agricultural efforts through the Farmers Union and the Potato Administration Committee. We have water conservation groups, including the Rio Grande Water Conservation District, the Water Conservation Education Initiative, Headwaters Restoration Projects, the Headwaters Trust, the San Luis Valley Ecosystem, and the Headwaters Alliance. And the key word being their headwaters is because the San Luis Valley and their snow and their water systems is the headwaters for the Rio Grande River system, which is the 4th largest in the United States. Additionally, there are community resources such as mobile health clinics and housing and resource centers. We're additionally partnering on a national level so that we can immediately provide interventions and resources for the farmers as soon as our pilot study is over, including AgriSafe, AgriAbility, and AgWell, all of which are focusing on total farmer health and mental health. And thank you so much for your time, and I'm looking forward to answering questions and shared questions with the other panelists. So I will stop sharing.